folks, we want to take you through how to get the best out of your therapeutic at-home ultrasound device. Now, first of all, tell us what's in the box.
Well, in the box, let me just open it up and have a look. You see, you get obviously the ultrasound.
Hopefully.
Woo! There's a gel in there. Now, an ultrasound must be used with the gel, but we will explain a little bit more about that later. Underneath is a cord, so it is a corded device.
Really important to understand that is not for charging. It is a very powerful device. Needs to be plugged into your power socket the whole time while you're treating. That's really important. And the manual, which gives all of this information that we're about to share with you, but sometimes people like to hear it rather than read it.
Absolutely.
So, yes, we need to plug the device in. As Em said, the ultrasound gel is essential. It's really important to create the conductivity because this is a high frequency sound device. In fact, it's so high frequency that you can't hear it. It's beyond the realm of human hearing. Those sound waves need to penetrate through the gel to be able to get through the skin to get to the surface of where the damage is, whether that is bursitis, tendonitis, a disc problem, meniscus problem in the knee. It could be any of these conditions, including arthritis, that this little device can really help you to speed up the healing of when you're at home, maybe in between visits or with your practitioner, or when you're just treating a little sprained ankle from home or what have you.
Anyway, you've got pain, I say.
Absolutely. In fact, you can use the device immediately after an injury takes place. It's very, very helpful in being able to deal with that acute inflammatory response, that initial swelling that takes place.
You don't have to wait until, if you injure yourself on the weekend, you don't have to wait to see a practitioner. You can jump onto it straight away.
Absolutely.
Yeah.
So the device has 3 settings. We use the pulsed setting for most of what we've been talking about for healing and for injuries. There are 2 other settings. One is a low continuous, which is good for skin, so wrinkles, acne, that sort of thing. The other is a high continuous setting, which is for fat blasting. But anyway, let's not worry about that. The high setting on the top, so when you go up 3 times, is our pulse setting. Now, the term pulse is a little bit deceiving. It doesn't pulse. You don't feel anything like a TENS machine or a vibration. It is that these sound waves, which as we said you can't hear, are pulsing on and off during treatment. Now that's essential for healing because what happens is the energy is passed on to the cells. The cells then have an opportunity to do what they need to do, realign if it's mending a damage in a muscle or something, while the sound waves are off, and then the energy increases again to increase the vibration of the cells, and then the sound waves turn off so that the body has got an opportunity for healing. It's really important. The research has shown the continuous ultrasound doesn't give the best results. The intermittent or the pulsed ultrasound is the best for healing, which is what we talk about the vast majority of time when it comes to repair and regeneration. So we turn it on, we go up 3 times, and then we use it on whatever area it is that we've got an ailment on. Now, you don't need to know the diagnosis of your ailment. It could be bursitis up here. It could be a torn muscle. It could be just some inflammation or even some issues with the ligaments. You just use the device over the area that's uncomfortable to get the great results. And this is what I love about it in clinical practice. We don't have to have a diagnosis. We would actually treat those conditions all in the same way, which is really helpful. Make sure you've got the gel either on the skin or on the device. I find it easier in clinical practice just to put it straight on the device. It's really good. Now, the next question is, how long do I use it for? We use the size of the head to determine how long to treat for. How many times does that head fit into the area that's uncomfortable? If it's twice, we multiply it by 2 and we treat for 4 minutes. If it's in the lower back and it fits 5 times across the lower back, it becomes a 10-minute treatment. That's how we determine how long to treat for. You can set an alarm on your phone or just watch the clock and turn it off once you're done. The device is obviously versatile for lots of different areas of your body. So the tendency for people to treat this and then their neck and then their sore knee is quite high. Feel free to turn it off in between because after 15 minutes it has a timer. It will turn off anyway. As I said, it's a pretty powerful device, and after a period of time, the device needs a bit of a rest or it might start to heat up. Now, talking about heating up, we don't want the head of the device to heat up. This is a 1 megahertz unit. There are 3 megahertz units available, not from us, but from other places. 1 megahertz goes deeper into the body, goes up to 5 centimeters. 3 megahertz only goes under the surface of the skin in a less deep way. And that, as a result, doesn't get to joints when we're trying to deal with arthritis or deep disc problems or things like that. So we wanted the more powerful unit to be able to get in there. So as a result, we want the ultrasound to have a little bit of a rest in between treatments. The head itself, however, should not heat up. You may have been to a physio where you've had a device used on you where it warms up. That's likely to be a 3 megahertz unit where the surface of, just under the surface of the skin's being treated so some warmth can take place. We want the deep penetration of those sound waves to be deep underneath the surface, so there should be no heat felt as a result of the treatment. That's really important. So don't worry, you don't go, oh, but the head's not getting warm. It's not meant to. You're not meant to hear it. You're not meant to feel it, other than the benefits of using the device, of course, from the perspective of what you can feel on the surface of the skin. Generally speaking, a lot of people say, look, I feel great after using it. Some cases when there's a lot of inflammation and a lot of damage, it takes a period of time before you'll start to see the results. But in clinical practice, we find that people feel great straight after using it. So that's a bonus as well. How often can you use your device? Now, it depends on what's going on with your body. As I said before, you don't need to know a diagnosis, but let's say, for example, you've got an ailment with your foot and you're expected to walk around at work. You can use the ultrasound before you go to work just so that you can get through the shift. When you get home, obviously being on your feet will create inflammation and aggravation to, say, a plantar fasciitis, for example, or a heel spur. You can then use it again when you get home. And if you find that you've then got to go in the kitchen and cook the kids' tea and your foot gets sore again before you go to bed, you can use it again before you go to bed at night time. In fact, I use the device 3 times a day for a stress fracture in my foot. Within 2 weeks, I was back on the footy field. So you cannot overdo this device. You don't need to sit and do a small area for 20 minutes. Just the desired amount of time, as I said, with the treatment head to decide how long, then give your body a chance to do the healing for you. Fine to go ahead and use it again in a few hours' time, but you don't need to sit there for ages and use it over the top. Give your body a chance to do the healing. Now, when it comes to healing in clinical practice, to enhance the effect of the ultrasound, I always use the trio of creams to assist. To heal an injury, the body needs 3 things. It needs blood flow, which the device will give you. It also needs building blocks to repair the damaged muscle, ligament, disc, whatever damage has happened, or even the joint for arthritis. So for that, we use the ChyroFix Injury Relief Lotion or the Bone-Aid Relief Cream. If you've got the tubs, ChyroFix is called Trauma Cream in that regard. They're the same active ingredients. This is helping with any of the soft tissue. So whether it's a bursa, tendon, muscle, ligament, capsule, disc, whatever. And then the Bone-Aid helps with obviously bone, but also nerves. So if you're suffering from neuropathy, sciatica, any of those, or just your ailment is painful, use both. So we literally put the 2 creams on, rub it on the area you're about to treat with your ultrasound before you start. Then the gel, you must still use the gel for conductivity. Use the ultrasound for the desired amount of time, wipe off the gel, and then reapply the ChyroFix and the Bone-Aid, and then add Heativate. Heativate brings blood flow for the long term. So the ultrasound, while you're using it, yes, it will increase blood flow, necessary for healing, really important for the body to push the blood to that area to give the healing nutrients, oxygen that's required for healing. But once we've stopped using the ultrasound, we want to use Heativate to be able to encourage further blood flow. So the ChyroFix and the Bone-Aid will provide the building blocks. The Heativate will drive it into the tissues so that you get continued healing for hours after you've finished using your ultrasound device. A lot of people say, why do you then reapply it if you've just used it? We want to continue to give the body the building blocks that it requires for healing, because otherwise, if it doesn't have what it needs, it sits there and waits for that to come through your food or to come through your next application of cream before it gets the opportunity to continue healing. And I know for the vast majority of us, we just want to get back to doing what we're doing and what we love without the discomfort as quickly as possible. So using the ultrasound in combination with the trio of creams will get you the fastest result. That's what I've experienced in clinical practice, and that's what our community has been sharing their results with us, and very happy with how using them in combination works really powerfully to enhance healing. So simple as ultrasound on the pulse setting, always use the gel, keep the device moving. And if you really want to enhance your results, grab the set of trio of creams to be able to assist with giving the body the building blocks that are going to help you to heal.
Absolutely. Now, I just want to let you know that once you're finished, just get a tissue and gently wipe away the gel. You don't have to twist. The silver head isn't meant to move.
Please don't twist the silver head.
Nice and gentle. Try and do this as soon as you finish the treatment, because you really don't want the gel to be drying on there and, you know, caking on, and it gets harder to clean. So
if you do accidentally leave the ultrasound, the phone rings or the doorbell goes or something of that nature, people don't even come to the door these days. But anyway, use a wet wipe to assist. Try not to drag a cloth or tissues. We just use tissues to clean it, but a wet wipe will be a really good way to be able to help if the gel has set a little bit onto
and then when
the
you
device.
finish, make sure it's unplugged from the wall and pack it away.
Super important. Please don't leave it plugged in. It is definitely not a rechargeable device. And if you leave it plugged in, it will continue to draw power and then your handle will become hot. We don't want that to happen. So pull it out. Don't wrap the cord around your device, because that can damage the fibers, the electrical fibers and wires inside your cord. Just allow it to be nice and loose. In fact, in our house, we've got a toiletry bag that we place it in, nice and loosely wrapped with the cord, if you like, sort of just sitting in there. And that means it goes with us with our little trio of creams traveler that we put inside it so that we can move it from couch to where we do our lives, to bedroom, wherever we need it to do our treatment. So it's a really good way to keep everything together, including the
absolutely.
gel sits in there. So enjoy your therapeutic ultrasound. If you've got any questions, any ailments that you're struggling to heal, please email us. We're here to help you in whatever way we possibly can. Thank you for joining us, and thanks for having us on your therapeutic journey.